I do want to talk about like your top 10 prevention, because I mean, many of these people are going to try and prevent diseases, like cancer. So I know in order of priority, you've mentioned sort of the diet and exercise, but maybe just give us your top 10 areas in terms of how to prevent this disease the best way. Obviously, it's to make sure that you've got the best mitochondrial efficiency and these mitochondria working and the electron transport chain working exceptionally well. But if you had to put it in order of priority, what would be the most important things that people can do right now that are listening to say, I want to prevent this disease? Because once they've got it, there's so much fear in the system, Prof, that they've got a fear, they get this amygdala hijack. There's no prefrontal cortex even thinking, logical thinking. I've sat with loved ones, I've sat with patients, I've got compassion fatigue after 25 years of practice, because I look at people that I've spoken to and now they've got stage 4 cancer. They didn't listen to me 10 years ago. So they're just not listening from this amygdala hijack. So tell us, prevention-wise, what you think the most important strategies are.
Well, let's break it down into two major categories first. What a lot of folks do is they overlap prevention with treatment. And like you just said, you should have listened to me before and you didn't. Now you got this problem. Okay, well, prevention now is out of the discussion. We have to now try to manage what you have. Okay, but if you knew how to prevent cancer, then you wouldn't be talking to me about how to manage it. So what we did in 1990, just to give you an idea of how powerful prevention is, we stopped the smoking. Anti-smoking campaigns were initiated in the early 1990s. And it became powerful because you were infringing upon the health of others by your smoking. So the restaurants used to have smoking and non-smoking, and then no smoking. And then if you get caught smoking, you had to go outside. And according to the American Cancer Society, we've reduced cancer by about 30% as the result of the anti-smoking campaigns. So they have a nice, if you look at their latest publication from the American Cancer Society, they have a trajectory that if we didn't stop smoking, how many dead people would we have from cancer today? And they estimate that we would have 30% more dead cancer patients today if we didn't stop smoking, right? So we have all these fictitious cancer patients that would have been dead if we didn't stop smoking. So they come out and say we're making major advances in cancer because we have 33% lower deaths today than we would have had if we continued to smoke. Okay, so that tells you the power of prevention. Okay, so today obesity is replacing smoking as a #1 risk factor. And obesity is often linked to type 2 diabetes, hypertension, high blood pressure, all these other things, and all of which damage oxidative phosphorylation chronically in the body. So if we were really, really interested in prevention, we would see very, very few obese people. The fact that we have a worldwide obesity epidemic tells us that we're really not that interested in preventing cancer. Otherwise, people would say, oh my God, I put on 5 pounds. I got to reduce these 5 pounds. Otherwise, I'm going to get colon cancer or something like this. So prevention is education. And don't forget, the anti-smoking campaign would have never been possible had your behavior not impacted on someone else's health. So it was a societal peer pressure. There's no society peer pressure to say that fat guy over there is impacting on my health. And that's not happening. And we can't blame, it's a blame game. So we're going to have this problem. And you have to know that it's extremely difficult to get cancer if you maintain your mitochondria health. How do you maintain mitochondria health? Well, diet and exercise for sure. But we developed a quantitative biomarker to let people know what they do to remain healthy. And it was the glucose ketone index calculator. And I published that for brain cancer patients to allow them to know when they're in a zone where other therapies will now be very impactful in reducing their cancer. But I'm now realizing that a lot of these health gurus and all these exercise guys and health food guys, they're all using the GKI to know whether or not they're in a very healthy state in their own physiology. And the late George Cahill, who wrote many books on human starvation, said that our ancestors were always in a state of nutritional ketosis, where you had anywhere from 2 to 4 millimolar ketone bodies in your circulation. This is very much lower than ketoacidosis, which is about 18 to 20 millimolar, which is a type 1 diet. It's very critically, it's a critical thing. So to get 2 to 4 millimolar blood ketones, you have to have low glucose. You can't be eating many highly processed carbohydrate foods. You have to be doing considerable exercise and eating low amounts of highly processed carbohydrate foods, and you get into this state of nutritional ketosis, which then brings the bioenergetic capacity of your mitochondria to a new super energy state. Because my late great colleague, Richard Veach from the NIH, showed how ketone bodies enhance the delta G prime of ATP hydrolysis in mitochondria, producing fewer oxygen-free radicals. It is, and he called it a super fuel. All of our ancestors in the past were in this nutritional ketotic state. Cancer did not exist in any great number. Animals in the wild, like wolves and chimpanzees and these guys, they don't get cancer. Very, very rare, because they're in their natural diet and lifestyle. The number one killer of wolves seems to be injury. All domestic dogs are derived from wolves. The number one killer of domestic dogs is cancer.